Hey everyone, welcome back. Today we're going to talk about substance-related and addictive disorders. We are going to begin with a disclaimer. Symptoms outlined in the respective diagnostic criteria do not provide comprehensive definitions of the underlying disorders. These disorders involve cognitive, emotional, behavioral, and psychological processes that are far more complex than can be captured in today's brief summaries. Instead, the criteria are intended to highlight the characteristic syndromes, signs, and symptoms that indicate the presence of an underlying disorder. First, we're going to start with the science of addiction. Addiction is a chronic, relapsing brain disorder that leads to alterations in the brain's reward system, influencing judgment, decision making, memory, learning, and behavioral control. These brain changes can continue even after substance use has ceased. Next, we are going to look at a brain scan here. And this demonstrates the the effects of cocaine on the brain. So you can see that we've got one control brain there, and then we've got one brain that is on cocaine. This PET scan shows how the brain uses glucose, which provides energy to neurons for their functioning. This scan highlights where cocaine interferes with the brain's glucose metabolism. The left scan shows the brain of a person not using cocaine, and the red areas indicate the highest levels of glucose utilization. The yellow represents moderate use, and then the blue is the least area of use. Now, as we move to the other side, where this individual's brain is on cocaine, this reveals that the brain is unable to utilize glucose as effectively. Notice that there is less red and there is much more of the blue area, indicating reduced glucose utilization. So several areas of the brain show decreased metabolic activity, which leads to impaired neuronal functioning. So the key takeaway here is that substance use disorder can cause lasting changes in brain activity, which disrupt judgment, decision-making, behavior, memory, and learning. Dopamine. Dopamine is a neurotransmitter released during pleasurable activities, and it increases the likelihood of repeating those experiences. Substance use triggers the release of endorphins and other neurotransmitters, including dopamine, which are linked to the brain's reward system. The repeated release of dopamine in response to pleasurable experiences leads to brain changes that make it easier for these activities to be repeated. Over time, the brain begins to associate these activities with pleasure, and even after the drug use stops, it can still trigger cravings. By affecting neurotransmission, drugs can create effects that drive individuals to use them repeatedly, leading to long-lasting health problems. Here we see a PET scan, and this image demonstrates that repeated exposure to certain drugs impact the brain's dopamine receptors, which are essential for experiencing pleasure and reward. These changes in the brain make it more difficult for individuals to stop using drugs. Advancements in addiction science have paved the way for improved treatments for substance use disorders, helping individuals stop misusing drugs and regain productive lives. Treatment empowers people to overcome the disruptive effects of addiction on brain circuitry and behavior, allowing them to recover aspects of life function that may have been lost due to substance use. The research shows us that most individuals with substance use disorder require at least 3 months of treatment to significantly reduce or stop their drug use. Long-term treatment has been found to produce the best outcomes. According to studies that track individuals over extended periods of time, those who enter and stay in treatment typically stop using drugs, reduce criminal activity, and improve their occupational and social and psychological functioning. Treatment helps individuals counteract the powerful disruptive functions and effects of substance use disorder on the brain and behavior, enabling them to regain control over their lives. Additionally, treatment provides individuals with the tools to understand the relapse triggers and develop strategies for preventing relapse. So, what exactly do we mean by substance use disorders? Well, substance use refers to a pattern of problematic substance use that leads to clinically significant impairment or distress, as evidenced by at least two of the criteria listed above during a 12-month period. This definition reflects the current diagnostic criteria for substance use disorder, which differs from the previous DSM editions. Previously, diagnosis was based on criteria such as dependence and addiction. The updated criteria now categorize the disorder as mild, moderate, and severe, depending upon the number of symptoms present. Substance use disorder uses tools to assess the criteria outlined here. The most effective treatment programs offer a combination of therapies and services tailored to meet the individual needs of the patient. However, comprehensive treatment is not always available in all communities. Uh, you can see that individuals who are seeking care may need lots of different requirements to be able to participate in therapy. And this is going to be very important in the way in which we can meet the clients where they are, and give them as much as we possibly can. A key aspect to successful treatment is understanding and assessing a patient's progress and recovery. There is a particularly important aspect when making decisions in child welfare practice. Several factors can help assess whether parents are making progress in treatment, including their participation in treatment progress, the knowledge gained about substance use, involvement in support systems, abstinence from substances, and relapse prevention planning. Treatment completion should be discussed with the substance use disorder treatment provider to develop further strategies for monitoring and assessing progress. So here we are going to look at culturally relevant treatment. And this is going to be very, very important in substance use treatment, and very relevant, meaning that we need to respect and accommodate the roles, the values, and the beliefs of the individual, ensuring that treatment environment aligns with these cultural factors whenever possible. For example, some cultures have healing practices and traditions that are deeply important to families, and these traditional methods may be valuable tools in both treatment and recovery. Effective treatment programs also work to identify and eliminate potential barriers to care, offering services in language most comfortable for the individual client. It's essential for treatment to be geographically accessible, and the child welfare or the alcohol and drug services programs may need to collaborate on issues like transportation, visitation with the child, and other distance-related challenges. Additionally, for parents involved in the child welfare system, the treatment must be very family focused, addressing issues such as intergenerational substance use disorders, family relationships, dynamics in parenting. Cultural competence in the counselor is going to be crucial, and treatment should always be culturally relevant when working with individuals from diverse backgrounds. When child welfare workers are seeking treatment for women with substance use disorders, they should prioritize programs that address the unique challenges women face. Many women with substance use disorders have a history of childhood physical or sexual abuse or even emotional trauma that can lead to PTSD or other mental health issues that require professional intervention. Furthermore, women with substance use disorders are more likely to be victims of domestic violence, and female victims of domestic violence are more likely to develop substance use disorders. Women in treatment may also need to address parenting issues, which could be compromised due to the substance use. Relationships play a critical role in the recovery process for women, including relationships with counselors, peer relationships with other women, and connections with a higher power. These elements are reflected in the practices and the support groups such as Alcoholics Anonymous or Narcotics Anonymous, which can contribute significantly to recovery. It may be helpful to approach treatment when using a comprehensive model with 3 levels of service for women with substance use disorders. The first level is clinical treatment services, which include a wide range of services such as outreach, engagement, screening, detoxification, crisis intervention, assessment, treatment planning, case management, substance use counseling, trauma-specific services, medical care, mental health services, drug monitoring, and continued care. Ooh, that was a lot. Then the second level is clinical support services, and this is going to encompass primary health care, life skills, parenting and child development education, family programs, employment readiness services, educational remediation, support with legal and child welfare systems, support for housing, advocacy, and community-based recovery support. And then our final level here is community support services, which, when available, could look like long-term recovery management, housing services, family strengthening, childcare, transportation, temporary assistance for needy families, and employer support services, vocational and academic education, and support from faith-based organizations. So these services should be tailored to address the specific needs of women with substance use disorders and support their journey towards recovery. So the fifth edition of the DSM, the revised chapter of substance-related and addictive disorders, include substances, and it changes the disorder group, plus it changes the criteria of certain conditions. So the criteria shown here apply to substances other than caffeine, which is not classified as a substance use disorder, and it is addressed separately. Disorders such as alcohol use disorder, stimulant use, and others follow a very similar diagnostic criteria. However, nearly all substances are diagnosed based on the same general criteria, which have not only been combined, but also strengthened in their revised framework. The recent changes of the DSM have updated the criteria for diagnosing substance use disorders. Previously, a diagnosis of substance use required only one symptom, but the DSM-5 now requires 2 to 3 symptoms from a list of 11. Additionally, drug craving will be added to the list of criteria, while problems with law enforcement will be removed due to the cultural considerations that make that criterion difficult to apply internationally. This chapter now includes gambling disorder as the only condition in a new category for behavioral addictions. While pathological gambling was listed in the DSM-5, it was placed under a different chapter. The introduction of this new term in its placement in the updated manual reflects research findings showing that gambling disorder is similar to substance-related disorders in terms of clinical presentation, brain origin, comorbidity, physiological effects, and treatment. There are 10 types of substances. Here we have alcohol, caffeine, cannabis, inhalants, opioids, sedatives, hypnotics, anxiolytics, tobacco, and then other or unknown substances. Substance-related disorders are classified into two main groups: substance use disorders and substance-induced disorders. The following conditions must be classified as substance-induced disorders, so intoxication and withdrawal, or other substance or medication-induced mental health disorders. To assess the severity of these substance use disorders, a scale based on the criteria from 1 to 11 has been established. As we talked about earlier and you saw the slide, the presence of 2 to 3 symptoms as outlined in of the 11 was categorized as mild, 4 to 5 symptoms as moderate, and then 6 or more is considered to be severe. Substance use disorder, here we have that same scaling right here on this page. Substance use disorder is characterized by a problematic pattern of substance use that leads to clinically significant impairment or distress, as evidenced by at least 2 of the following criteria in a 12-month period. The substance is often consumed in a larger amount or over a longer period of time than intended. There is a persistent desire or unsuccessful efforts to reduce or control the substance. A significant amount of time is spent obtaining the substance or using it or recovering from its effects. Craving or a strong desire to use the substance. Recurring substance use resulting from the failure to meet major role obligations at work, school, or home. As we continue here, the individual continues to use substances despite persistent or recurring social or interpersonal problems caused or worsened by the substance. This is a key feature of substance use disorder. This includes the reduction or abandonment of important social and occupational or recreational activities due to substance use. Substance use continues despite it being physically hazardous or despite the knowledge of persistent or recurrent physical or psychological problems likely caused by or exacerbated by the substance. Tolerance is also present, defined by either a need for markedly increased amounts of the substance to achieve intoxication or desired effect, or noticeably diminished effect with continued use of the same amount of the substance. Withdrawal is characterized by either of the following: A, the presence of a characteristic withdrawal symptom specific to that substance, as outlined in the criteria for alcohol or other substance withdrawal, or B, the use of this substance or closely related substance, such as a benzodiazepine, with alcohol to relieve or avoid withdrawal symptoms. The physiological dependence, there is evidence of withdrawal or tolerance in either criterion A or B, and those are criterion numbers 4 or 5 are present. Withdrawal, without physiological dependence, there is no evidence of tolerance or withdrawal, but either criterion A or B is still present. In early remission, this refers to a period in which all criteria for substance use disorders were previously met, but none of the criteria have been met for at least 3 months, but less than 12 months. The only exception is that the criteria for craving or a strong desire or urge to use the substance may still be present. Sustained remission, this refers to a period in which all the criteria for substance use disorder were previously met, but none of the criteria have been met in a time period of at least 12 months or longer. The only exception is that the, again, criteria of craving or strong desire to use may still be present. Aftercare in a controlled environment, this is another specifier used when the individual is in an environment where access to the substance is restricted. On maintenance therapy is another specifier used when an individual is taking a prescribed agonist medication such as methadone or buprenorphine, or none of the criteria for opioid use disorder have been met for the class of medication except for tolerance to or withdraw from the agonist. This category applies to individuals maintained on a partial agonist or an agonist antagonist or a full antagonist such as oral naltrexone. Here are some IDC-10 codes for substance use disorders. I'm not going to read all these to you. You may feel free to pause and look at these codes in the slides. You can also find them in your DSM. So we're just going to move through these codes. We've got more codes here, more codes here. Continuing on, lots of codes. And here, now we're moving on to substance use disorders. For clinicians, they should not use the general code for the class of the substance, but instead record the specific substance and its corresponding specifier. For example, a clinician should use the code 304.10 for moderate opioid use disorder rather than a general code for sedative hypnotic use disorder. So if the substance does not fit into any of the standard classes, such as anabolic steroids, for example, the more appropriate code for other substance use is 305.90, mild anabolic steroid use disorder. What if I don't know? If the substance taken by the individual is unknown, the code for other or unknown should be used as 304.90 for severe unknown substance use disorder. As mentioned earlier, gambling is recognized as an addiction in the DSM-5. Other behaviors such as sex, shopping, video games, and even positive activities like running can also be seen as addictive. So some symptoms of gambling addiction include the need to gamble with increased amount of money to achieve the same level of excitement, feeling restless or irritable when trying to reduce or stop gambling, trying to unsuccessfully reduce or stop gambling, constantly thinking about gambling, both by reliving past experiences and planning future gambling activities, gambling as a way of coping with feelings of depression, guilt, or anxiety, attempting to win back gambling losses, hiding the extent of gambling activities, including the amount of money spent, losing not only the money, but also relationships, job, or significant career opportunities due to gambling, and relying on others for financial support to address the financial problems caused by gambling. Persistent and problematic gambling behaviors can result in clinically significant impairment or distress where indicated by the individual exhibiting 4 or more of the following symptoms in a 12-month period. So the need to gamble with increasing amounts of money to achieve the desired excitement, becoming restless or irritable when attempting to cut down the gambling, again, repeatedly making unsuccessful efforts to control, cut back, or stop, frequently being preoccupied with gambling, including persistent thoughts about reliving past experiences, handicapping, planning the next gambling adventure, or thinking about ways to obtain money to then gamble with. Often gambling then can contribute to feelings of depression, helplessness, guilt, anxiety, and depression. Chasing losses by returning to gambling in an attempt to quote unquote win back the lost money. Again, concealing the extent of the involvement in gambling, jeopardizing or losing significant relationships, jobs, education, or career opportunities because of one's gambling, and then relying on others for money to alleviate these financial difficulties that are caused by their gambling. This is our final slide. The gambling behavior should not be better explained by a manic episode, and it's important to specify with the following: episodic, if the diagnostic criteria are met more than one time. At one point in time, the symptoms subside between periods of gambling, and then the individual experiences gambling disorder for several months. Persistent, this is if the symptoms continue to meet diagnostic criteria for multiple years. In early remission, if, after previously meeting full criteria for gambling disorder, none of the above criteria have been met for at least 3 months but less than 12. In sustained remission, after previously meeting full criteria for gambling disorder, none of the criteria have been met for a period of 12 months or longer. And then again, you'll see the severity is 4 to 5 criteria met is mild, 6 to 7 moderate, 8 to 9 is severe. And that concludes our lecture. Thanks for your time and attention, and I'll see you in the next one.